Meanwhile, the Trump administration has put a freeze on many federal health agency communications with the public through at least the end of the month. Tonight, infectious disease experts are raising alarms that this could impact California's ability to respond.
As health officials work to contain the avian influenza outbreak, the Trump administration has ordered the Centers for Disease Control and Prevention to pause all external communications.
It's kind of like you disable your smoke alarm or your smoke detector.
Dr. Peter Chin Hong is an infectious disease expert at UC San Francisco. He says the CDC plays a vital role tracking data across the country.
Federal data is critical because first, it's a fast-moving outbreak. Second, the outbreak involves multiple states. So knowing what's happening in one state can only give you part of the picture.
But under this order, agencies such as the CDC, FDA, the National Institutes of Health, and the Department of Health and Human Services will not be allowed to publish scientific reports, issue health advisories, or update their websites, at least through the end of the month. This leaves California to face the crisis independently, Dr. Chin Hong says.
But California can only do so much because, again, it involves multiple states. There are multiple agencies. We don't have the resources to handle something this big. And you need federal help for resources, for coordination, and to prevent misinformation.
And the CDC stressed the risk to the public is low, and there is no evidence of human-to-human transmission. And Americans can continue to expect high prices for eggs this year because of this outbreak. The U.S. Department of Agriculture's price outlook shows egg prices are estimated to increase about 20% this year, compared to about 2.2% for food prices in general. The virus killed about 17.2 million egg-laying hens in November and December. That's nearly half of all birds killed by the virus last year.